Praise be to Allah, the cherisher and sustainer of the worlds. I'm Dr. Amsha Mushtaq Khan, and today I have the opportunity to present critical appraisal on the global burden of perinatal common mental health disorders and substance use among migrant women, a systematic review and meta-analysis. I will be using the transparent reporting of systematic reviews and meta-analysis PRISMA checklist. The PRISMA checklist has 27 items, including title and abstract, introduction, key points from the article. 1 in 4 migrant women experience perinatal depression, 1 in 5 anxiety, and 1 in 11 post-traumatic stress disorder. Higher prevalence of perinatal mental disorders compared to non-migrant women. Forced migrant women have a higher prevalence of perinatal depression, which is 33%, and post-traumatic stress disorder, 17% versus economic migrants. Recent migration, poor social support, and trauma are key risk factors for perinatal mental illness. This article highlights the need for routine screening, culturally appropriate interventions, and support for migrant women. Mostly data from the article is from higher income countries. Urgent need for research in low income host countries is advised. So coming to the critical appraisal, title and abstract. This is the title. The title clearly identifies the study as a systematic review and meta-analysis. It also accurately reflects the scope and focus of the review on perinatal mental health and substance use among migrant women globally. Abstract. The abstract provides a structured summary including background, objectives, eligibility criteria, data sources, study selection process, data items extracted, synthesis methods, results, limitations, conclusions, and implications. However, the abstract does not explicitly mention study risk of bias assessment methods. Introduction. Introduction provides relevant background on migration and perinatal mental health. It highlights the lack of updated prevalence estimates for perinatal mental disorders among migrant women, especially forced migrants, clearly describes the objective and the research question. Number 3 is methods. Method specifies detailed inclusion-exclusion criteria and how studies were grouped for analysis. It lists all databases, search, and other sources for study identification along with search dates. Methods present full search strategies for all databases, including filters used. For study selection process, the methods describe the study selection, including number of reviewers who screened records and whether they work independently. This is the PRISMA flow diagram of the study profile. Data collection process. The methods specify data collection from studies, including number of reviewers and process for confirming and obtaining data from study authors. Data items. Methods clearly lists and defines all outcomes data extracted. List other study variables extracted like participant and intervention characteristics. Notes assumptions made about missing information, but does not mention if all compatible results were sought for each outcome. Risk of bias in individual studies. Methods describe the process for assessing study risk of bias, including tools used, the modified CASP and JBI checklist, number of reviewers, and independence. Summary measures. The methods specify effect measures used to synthesize present results for each outcome. So the methods explains methods to determine study eligibility for each synthesis, describes data preparation methods, describes methods for tabulating, displaying, and synthesizing results, and rationale for choice of meta-analysis model, provides the softwares used, describes methods for exploring causes of heterogeneity and conducting sensitivity analysis, specifies methods for assessing risk of bias due to missing results, and describe methods for assessing certainty of evidence. The methods highlight include the review protocol was registered with Prospero, which enhances transparency. Eligibility criteria are clearly defined. The literature search strategy is comprehensive across 7 databases without date or language restrictions. Study selection and data extraction were done in duplicate, reducing bias. Valid tools for use for quality assessment and sources of heterogeneity were explored through group and subgroup analysis. Meta-analysis methods are described, deviations from the protocols are explained. Overall, the methods are rigorous. Now, results. The results present study selection via flow diagram from records identified to studies included. List studies excluded after full text screening with reasons, describe characteristics of individual studies in text and tables, present assessment of risk of bias for each study. For all outcomes, present summary statistics, effect estimates, and precision for each study in structured tables and plots. For each synthesis, summarizes characteristics and risk of bias of contributing studies, presents results of all statistical synthesis conducted, including summary estimates and measures of heterogeneity, compares groups, presents results of investigations into causes of heterogeneity, presents results of all sensitivity analysis assessing robustness of findings, presents assessment of risk of bias due to missing results for each synthesis, presents assessment of certainty of evidence for each outcome. The highlights from the result include the study selection process is shown in a Prisma flow diagram. Study and participant characteristics are thoroughly summarized in text and tables. Meta-analysis results are presented with forest plots. Heterogeneity is assessed and discussed. Sensitivity analysis provide important context on potential sources of variance in prevalence estimates. The narrative synthesis of risk factors is appropriate given the limited data. The results directly address the research objectives. Number 5 is discussion. The discussion interprets results in context of prior evidence, discusses limitations of included studies, discusses limitations of review methods, discusses implications for practice, policy, and research. The discussion highlights include the authors interpret the findings in context of prior literature and discuss limitations like study quality, publication bias, and heterogeneity. They highlight implications for screening interventions and policies to support migrant women's perinatal mental health. Directions for future research are identified. Overall, the discussion is comprehensive. Number 6 is other information. The article provides registration details, including register, registration number, and link to protocol, notes protocol amendments, describes sources of support, role of funders, declares competing interests of authors, notes availability of materials to allow replication, including data collection forms, extracted data, and analysis code. The study adhered to reporting guidelines, Prisma and Moose. Funding sources and conflicts of interest are disclosed. The large sample size and rigorous methods are strengths. Some limitations are the reliance on observational studies, high heterogeneity, and dominance of data from high-income countries. Overall, this is a high-quality systematic review that makes an important contribution to the literature on migrant women's perinatal mental health. The sources of funding are clearly disclosed in the article. Now, coming to the summary, the strength of the articles are that it clearly defined research objectives and eligibility criteria, comprehensive search strategy across 7 databases without restrictions, rigorous study selection, data extraction, and quality assessment done in duplicate, use of validated tools for quality appraisal, which is CASP and JBI, investigation of heterogeneity through subgroup analysis, and adherence to Prisma and Moose reporting guidelines. Large number of individual studies, 135 studies and 6,22,000 participants, inclusion of studies from multiple countries and in multiple languages, provides updated prevalence estimates for perinatal depression, anxiety, post-traumatic stress disorder, and substance use in migrant women, provides first meta-analysis of perinatal depression and post-traumatic stress disorder prevalence specifically in forced migrant women. Now, the limitations are that most included studies were of medium quality and observational design, that is cross-sectional, high heterogeneity between studies for some outcomes, most studies from high-income countries and lack of data from low-income countries, few studies with prevalence data on less common disorders, for example, psychosis, reliance on screening tools rather than clinical diagnosis for mental disorders, inability to meta-analyze risk factors for disorders other than depression, and possibility of publication bias towards positive findings. The summary of key points. Overall, the article is a high quality systematic review that synthesized a large body of evidence on an important topic. Key limitations were the reliance on observational data and high heterogeneity. However, results consistently highlight a high burden of perinatal mental illness in migrant women, especially forced migrants. And the authors provide reasonable conclusions and highlight important implications for policy and practice. The checklist used for the critical appraisal is PRISMA. This is the reference for PRISMA statement. And thank you very much.